Here, guys.
With a remark, with an answer like that, what do you think? Did I talk to him?
Meeting shall come to order. Alex?
As you know, a number of us are not with us tonight because they're at the 50th anniversary of the St. Vincent fire. There's an observance going on there at the college, and former Chief Dalton is being recognized, fire chief, including the fire chief of Greensburg, Hutch. Amazingly enough, he was fire chief back then. I guess he was fire chief since the early 50s. Besides him and Fidel Castro, there's very few world leaders.
He's got this year, he'll have 72 years in.
It's
Got all.
Fidel Castro.
You know, I can remember that fire just like it was yesterday with my dad being a fireman and that. And I can remember him, of course, he worked at the MP in the meat department, okay? I can remember him going and staying at that fire for 3 days. 3 days, and Mom raising all kinds of hell at him, you know? Mom raising all kinds of hell when that fire whistle blew. But it was something. I mean, it was really amazing.
And we appreciate the colleges reaching out, and I know a number of the firemen are there tonight and participating in that recognition. As you know, on some things I've left for you, on February 11th there will be a hearing at the beginning of our meeting for the Latrobe Industrial Development Authority. They've received a request from St. Vincent College to refinance 2 existing bond issues, which were originally financed through the Latrobe Industrial Development Authority. The refinancing involves the Series 2001 and 1998 bonds, which represent about $12 million in existing debt. The new bond issue will be for $17 million, which will permit various improvements to be made by the college. This is very similar to things we've done in the past, most recently for Bethlehem Homes, where we had, we had that done at our council meeting. So I have for you, I think, the advertisement that they made in the newspaper, and you can review that. The next thing, we have 2 items, and I'll just ask maybe Jim and Public Works, Joe, to address. If you recall, we had a discussion about brake retarders or Jake brakes, and then there's a request for a stop sign at Josephine and Raymond. Staff has been looking into particularly the PennDOT issues related to the Jake brake and stop sign as well. Jimmy, would you like to address those, at least maybe some of your concerns that you have?
I did give council each a paper about stop signs. That's, of course, addressing the Josephine Street, Raymond Avenue. There was a small petition circulated to put a stop sign there. I don't feel that it's in the best interest to put a stop sign there. Number one, the reason for the petition to be circulated was to slow cars down, and that's not why you put stop signs at intersections. You put stop signs at intersections to designate right-of-ways, not to...
I'm sorry to hear you, Jim. What's the intersection where they want...
Raymond Avenue and Josephine Street. That would be putting a stop sign at the bottom of that steep graded hill, which also could be a accident waiting to happen for the first, till people get used to that. So I adamantly oppose putting a stop sign there. On the Jake braking, the only thing I can say about that is in 29 years I've never had a complaint on Jake braking, and neither have any of my guys. I talked it over with my guys. I also had some concerns with the gentleman who did request it when he said that the trucks go 50 miles an hour up the 500 block of Main Street, and I really don't believe that's physically possible. So I do have some concerns with going through the signage and the engineering traffic study, and I am not clear on exactly what PennDOT wants for that when it's an SR route, or it's part of an SR route. There's different stipulations. I'm not real clear on that. I didn't go over it with a fine-tooth comb. I do know there is some stipulations though, but I do oppose that.
Well, you know what, Chief Kumar, let me say this, that I've noticed the trucks traveling very fast on Main Street and Depot Street. And believe me, when they're traveling fast and they're noisy with a Jake brake, it's disturbing. I asked if we couldn't have a Jake brake ordinance that would affect Main Street, Depot Street, Lloyd Avenue, Lincoln Avenue, and Ligonier Street. And only those areas that do not have a 4% grade. The one prohibition that PennDOT has said, if it's a greater than a 4% grade, that would be like one up over Laurel Hill Mountain. You can't have a restriction on the Jake brakes, but these are all primarily level streets. And these people are going through our residential neighborhoods. And, you know, I think it's about time that we consider noise is just as much of a problem as perhaps improper parking, because that sort of disturbs the peace.
I do understand your concerns, Mr. Jim. I would like to know if there's more complaints though. Have you had many complaints on this?
Yes, I have. I've had two in particular, one from Danny Pastry, also this gentleman that came up and spoke here.
That was Mark Scarfo.
Mark Scarfo. And you know what? We try to bring the complaints that we hear and also from our own observation. And it's my observation that those trucks do travel quickly. As a matter of fact, well, anyway, that would be my recommendation.
Okay.
I think we've been on all fours. We're spot on if we stick with those streets because they're all under 4% grade and we exempt municipal vehicles.
I respect your concerns, Mr. Jim.
I'd like to add that I don't know if it's the engine brake retarder that's the issue. That's the Jake brake.
Yeah.
I don't know that that's the issue. It might be just the fact that they might be traveling over the speed limit perhaps. They make a lot of noise. That's the nature of the vehicles, just regular braking. But I've never heard Jake brakes in town. The actual Jake brakes. And especially on the flats there, I don't think they would be utilizing them. Yeah, Joe?
Yes, I'll comment first on the engine brake retarder. The 4% grade, Mr. Jim, is not the only stipulation the state has. First of all, you must have written approval by them to do that. Second of all,
that's taken for granted, Joe, that you have to get written approval. I'm just arguing from our point of view. I know that you have to submit for a written approval.
Mr. Jim, yeah, I think we do meet all the criteria that's set forth by
second of all, Main Street, Lloyd Avenue, Depot Street, those are state highways. On a state highway, a Jake brake engine retarder is considered a safety device and cannot be regulated. So the way I interpret that is we cannot.
I don't interpret it that way, Joe.
The way I interpret it is we cannot. So I think that that's something that we have to research. I too have never heard of a complaint in all of my years up till this one. I suggested that perhaps this is something that the police on second and midnight shift could maybe take a look at as far, before we go ahead and go through with the expense of an ordinance. And also when the comment was made, all we have to do is put a few signs up. That isn't true, because when you do something like that and have certain areas, Mr. Jim, you have to not only post where they begin, but you have to post where they end, and you can start using them again.
Let me tell you something. We're the city of signs. You've got signs everywhere. Where there's no parking in this lot out here, you have 40 signs. Each sign is in front of a space that says no parking.
Well, Mr. Jim, I'm not arguing. I'm just doing what I'm paid to do.
No, you are arguing with me.
Okay.
And I'm arguing with you.
Okay.
I wouldn't want the city to enforce anything that would be against the law, but I do think but these are anyway the parameters that I feel should be followed.
What would happen is basically, as I shared with you, we would make the request to PennDOT, and then they would do the the analysis.
Correct.
Um,
And maybe what Joe is saying is absolutely right. I didn't read it in that specification, Joe, or I'd say that I did. I did read the 4% grade. And that would possibly be a grade that would be on Main Street from Ligonier Street out. I don't know what that grade is, but, I'm just saying that I'm not sure what that one is. But anyway, my recommendation would be those 5 streets.
If I recall, I think there's a song named Signs, something like that, Richard.
Was it?
There's a song named
Signs
Signs.
everywhere.
But, I look at these guys with their Jake brakes, and I have it out front of my house, and I live on the highway right there. And it comes down to is I just think it's a little bit of a hot dogness with these drivers, because I have a brother's a truck driver, and I asked him to drive all through Latrobe last week after that gentleman was here. And I said, you ever use your Jake brake? And he said, no. I said, how about on Main Street coming down there before going up? He said, well, I'd have to use my Jake brake. There's a stop sign on every corner. I shouldn't have to pick up no speed whatsoever coming down. So these truck drivers are using them. It's uncalled for. I don't know if they're going to the business at the top of Main Street up there and coming down from it. Maybe we ought to look at having somebody go up there and talk to the business, tell their drivers that come in and out, would they please, stop it. There's no reason for it before we look into putting money into signs and see where it goes from there.
Might I suggest to council, why not have me or the city manager, somebody, write a letter to PennDOT and say, here are the specific streets that we are considering addressing with a prohibition sign. Tell us specifically with regard to whether it's a state route or not, what are your restrictions and guidelines. Then we'll know. Then we can decide what we want to do with any given street. But until we know, we're just guessing.
What Jake brake I think sounds like is a truck without a muffler, essentially. I mean, that's what it sounds like to me when you're using a Jake brake.
This is all. But,
No, I agree with the solicitor. That would be the method.
When they're using the Jake brakes, that's slowing the truck down, and they want to use the Jake brake if they are using it, because they don't want to wear their brakes down, especially if they own the truck themselves, probably. They don't want to spend the money on brakes until they have to. So maybe the problem's just speed, and then what can you do with speed if you can't have you certainly can't have an officer there 24 hours a day, or maybe the time that when the truck's running at there, but then they have to follow to get a speed, or can they use a fast car type situation? There's probably a lot of other restrictions. Yeah, a lot of restrictions on what you can use it, when you can use it.
Speaking to the sign situation, I'd like to see probably 2/3 of the signs in this town removed, just from an aesthetic standpoint.
Last year, we removed a number of them on the north side.
We'll have to look at over at North Side again here, but
In other
I know
parts of
there's some
town.
more.
Yeah.
The hospital's growing smaller, they have no need for all the permit. Mr. Deputy Mayor, and just to comment on the stop sign on Josephine Street, I too am opposed to that stop sign. I think wet roads, winter times, I think that could be more of a harm to put a four-way stop there than it would be to have those people traveling east and west on that street.
Which one's Josephine? Is it run parallel to Pine?
Just
Right alongside shopping.
Yeah, right. Yeah.
Yeah,
Which one? Which side of it?
Gregory Fleming.
McDonald side.
Yeah. Okay.
Straight to San Francisco.
Yeah. Yeah. I know. Okay.
Are there other items that council or Joe or Jim that we missed for the agenda?
I have an item concerning parking meters that I'd just like to mention, Deputy Mayor. This isn't.
Pango? You're going to promote Pango, Richard?
Oh, yes, of course. I saw we're going to be buying an awful lot of inserts for parking meters, and I wondered if we couldn't do an assessment of meters that we don't need. There are meters like I said, on the south side of Spring Street that perhaps we don't need. There are meters down at by the hotel loyal that we don't need. They don't get policed, they don't bring in any money, and I don't know why we want to buy new insides for them. And the second thing is that I've had a lot of complaints about the garage, the usage of the garage with all the private signs. I think there's a sign for each stall that says private parking, that it doesn't leave enough meters on that first floor and first level for in and out customers. And I'm just wondering why somebody chose to put the reserves on that floor in lieu of, say, putting them on the second and third floor, where you could have one sign that theoretically would say reserved parking only.
Permit parking, yeah.
Yeah, on this side.
You see where I'm coming from?
Yeah, I don't know how would we go about changing those places? Can we keep that first floor open?
Currently, the garage has 9-hour meters on the first floor, and it has a row of parking that's permitted for reserve spaces. There's about 78 or 80 meters in the garage right now.
106.
106 meters in the garage right now, which it had 105 meters in there before. So it has one more than it once did. But that's certainly something, we're working with the people who are using it to adjust. I get criticized by saying I tweak it and we play too much with it, but we're certainly open to adjusting them. The reserve spaces are exactly where they've been for 20, 30 years.
Oh, really?
Yeah,
There's been no change or no increase in the number of
I
reserve?
don't recall seeing those reserve spaces in the garage. I never saw a sign in that garage before.
Okay, well, we've been selling reserve spaces for,
We've been selling the reserve spaces.
and they had signs on them.
The signs
Are
on
they
the
the
car.
same as they were, Joe?
Basically, only they were mounted down lower and that. Now, since we did the garage, we have them mounted, they're all uniform and up. Mr. Deputy Mayor, those reserve spots there are what we call the golden spot or whatever. When you come up there, you actually have your own designated space. It is just not like if you come up there and you have one of those that you can pull in any one of 20 spaces. No, maybe the third one down is Ken Boldenary, so that's yours right there. So those are specific to the.
What are those costs?
Those are $55, I believe. Those are, again, to be clear, there are two kinds of passes for the garage. There are reserved spaces, as Joe has just mentioned, and then there's general passes. And what we've been trying to do, there's about 270 spaces in the garage. 20 of them are reserved. So 250 of them are either the 106 meters, or the rest of those are available for people to park who have just general permits. So again, if you do the math, there's 144 spaces available for general permits, 22 or 20 available for reserve spaces, and about 106 meters. We're trying to.
How much have you been getting in those meters?
I don't have that figure in front of me. I can get it for you.
What's the average occupation of the garage?
Well, we've been counting, and would say 150, 180, Joe, is sort of the number we've been averaging.
Yes, as of late.
How many spaces are in there?
270.
So we lost about 100 people coming to that garage since it was closed down?
That is assuming it was fully occupied.
No, it was fully occupied. Moses sat there at lunch with you and Rosie and told you that garage is packed all the time.
It became, Mr. Giovanangelo, it became pretty well utilized when we had that $10 rooftop. We've got quite a few people that come in and started utilizing our garage.
So we're going to do
It
now,
was
get
pretty.
it up there because it's a lot of.
Well, that number actually, I think that's an increase over what it had been.
Well, again,
this fall, right? I mean,
It
it's
has
fall.
been seeing more increase, especially with the weather being inclement.
Right.
I think
So
a
it's
number of
less.
factors have harmed us, and that's the loss of businesses intermediate to the garage. Maybe that's part of the reason. Back to Richard's initial comment, the idea of pulling back meters or analyzing it is valid. I think you mentioned McKinley.
Yes,
But I mean, other streets as well.
Yeah, there's a lot of, we have a lot of meters, we can get them policed, and I don't know if we should be spending the money to replace the insides.
Yeah, because you go always down Linger Street down to Miller Street, and from Hotel Little down, I never seen nobody there.
No.
Write tickets and stuff.
No.
I might be wrong, Jimmy, am I about right on that? From the underpass down to Miller Street.
I know
nothing.
when Moselle was here, before I was chief, that was a officer only area, she never went down there.
Right, that's what I thought.
Speaking of policing, how many hours a week are we getting out of Kay or whoever is doing
She's
it?
averaging about 30 a week, 30, 32.
And it's all on the street, 30, 32 hours
Yeah.
a week?
She'll do some office work there?
Well, she's a 40-hour-week person, and she does assist, and we're cross-training tax office to go up to Joe's place, and we're cross-training the women who are in the office to do ticketing as well.
Is there any move underfoot to get her an automated or an electronic ticketing device?
Yeah, we're looking at that. We're concerned the cost may not be worth it. The ideal would be to have one because it reduces the hours spent entering the data in twice. You make a ticket by hand, then you go back to the office, that gets entered in twice. But they're very, very expensive.
I'd like to have a discussion with you privately on that if I could sometime. Just one-on-one, kicking around that idea. I think there could be a device that you just have to type in the number, go back to a central place, and it'll find out whether or not
Download it.
bang goes right. And you could even program it so that it could send out the,
Yeah, I'd love that.
you know,
Have you looked at, have you priced those?
I spent a lot of time with computer programmers, including Visual Alert today, who's our software provider for our police. I spent a lot of hours with techs and other computer folks to figure out cheaper alternatives than what Duncan and other firms. They offer handhelds. The handhelds, quite frankly, are $10,000 to $16,000 a piece.
Get out of here.
you know what, I think it'd be worth it.
And when I'm looking at not only those, but also, can we, if you will, use a computer,
I was just
tablet.
going to say, is there an app? Is there an app on it? You just use
I was told by
smartphone
Visual
or
Alert today that
iPad?
it's not worth it for them to develop such a thing based on one customer's interest. But anyways, it's not over yet. I would love to see what research or ideas you have.
Sure.
Because again, if we can reduce the entry, the ideal is to be able to have the Visual Alert on a computer that when she's making the entry, it's going automatically into the system instead of going back to the office and then entering it into the software.
And I had one step. After it gets into the system, it automatically sends out the notice.
Well, the handhelds print at that moment a ticket to place on the vehicle. If we had the ability through the DOT and others to send people emails and text packets, that's a whole other thing. Because I know when Visual Alert is entered in, it has an identification component related to that.
Right, it'll generate a site.
I'm talking about a letter or a little card that says you didn't pay your meter on such and such a day at this time. Just a pre-printed card that would automatically come out once it's determined that that car is in violation of that.
Okay, that's interesting. I love talking about that.
Do you have a report on the meeting in the hospital?
Richard wants to know, a meeting at the hospital. I can say from my perspective, it was well attended. There was Bob Rogulski, Mike Bush, Tim Fidel, Jennifer Millet, and one other, Ron Ott were there from the hospital, and Alex, Vince, Katrini, Jim Okanak, myself,
Rosie.
Nick Felice, Rosie. We had lunch there. We expressed our concerns. They presented us with their reasons for doing what they're doing. And they actually offered to put this on hold. And we're to come up with an alternative to what they had proposed. And, Dr. Waddle was there also. So, or your never mind.
We found out he was indeed born in the United States and not in Africa. So it's legal.
That's good. I'm glad you found that out.
You said Dr. Wagner?
Why?
Why?
Yeah.
Mr.
Yeah.
Deputy Mayor, I wonder, you know, the hospital put a temporary building, I think, over by the hospital, outside the front entrance. I think it's a double wide mobile home for pregnant women to
You mean
visit.
the catty corner on 2nd Avenue?
Yeah.
Yeah.
My
It was a
question,
blind.
my question is this, Mr. Deputy Mayor, why would they put that $100,000, maybe a $60,000 building, you know, in our R1 residential district, and now they're going to turn around and build a $10 million all brick, state-of-the-art site out in Unity Township? Are they still going to leave that building over there?
That building's been there for what, 20 years now?
Well, yeah,
Well, you know, and it was
it's
just
not lived, it's
23,
useful.
so it's been there at least probably 25 years.
Yeah, and I think
It's
the
not being
reason, but
used.
I know, the reason, when that was built, don't forget, the hospital was completely full. I mean, it was full of offices, patients, whatever, and they needed that space at the time to offer their services.
Are they gonna,
I don't know what it is, it still there? I
It's
can't-
there, but it's not being used.
Yeah, it is.
It is.
did they say what they're gonna
I've
do
been
with the
going in down there all
hospital?
the time.
They think that by consolidating all their physician offices and services up here in Unity Township, that this would enable our hospital to stabilize it and have it grow.
So I remember about 15 years ago, they talked about this, and they were talking about system and M4s and stuff like that.
Well, I think they went along those lines. They started that neuro, what is it? What is the specialization that they have up there?
Neurology.
Well, it's not neurology, it's a geriatric neurology or something. Isn't that the case, Jim? Do you know offhand? Isn't that what they're one for? Alex, do you know?
I'm just trying to look through the paperwork they gave us. They gave us a bunch of stuff that they've done over the years to improve the
Yeah.
facility up there. Again, their claim is that the business model of the current healthcare industry requires that they do facilities like this to get the referrals and get the patient, in-bed patient capacity at the hospital to its highest. They say that they're losing about 3,000 patients are finding their way, whether it's to Indiana or Conemaugh or UPMC and maybe Somerset. And that capture, they'd like to get back at. And the way to do that in their mind is these kind of one-stop all, meets all the facilities.
Kenny, I was.
I'm just saying what they.
I didn't mean to smile on that.
Are they planning on closing, for example, there's a facility up in Blairsville that is kind of like a feeder system. Are they
Right.
planning on closing these outlying feeder systems?
There
So
are
everybody has to come here?
some that are going to be closed. The only one that they were talking about specifically in Latrobe was family practice, right, Alex?
That's the busiest part.
Yeah, I know. I argued that their clientele was such that they prefer to stay within the borders of this town, and most of them are, let's say lower income and elderly patients. We argued, we presented our points. That seems to be the only physician's office that's going to be moved totally, but they're talking like Norville.
What they provided us was to consolidate 18 to 20 locations in and around Unity Township into the single facility. So 18 to 20 locations is what they've advertised that will consolidate there.
Right.
I understand that there used to be 300 beds that were kept pretty full in the hospital, and I think they're down to 100 now.
108 private patient rooms.
Okay.
Did
Yeah,
they say-
I'll throw something out.
What's that?
They're not the only show in town. There's Indiana Hospital, and they're coming down to Blairsville.
Right, well, that's,
And they're feeding
they
them that
did the
way.
exact same thing that Excela wants to do in Unity, Indiana
Well, what I'm
already has
saying is,
done.
if they want to move out of town, maybe Indiana regional might want to move in town.
Well, then again, no, we don't want to,
When that was suggested,
Yeah.
it seems to that, in their minds, would run the risk of harming our ability to have a hospital in the
Right.
future. That's a polite way of saying it, I think. Is that polite enough?
You gotta remember, they moved a lot of stuff out of Latrobe, that's why they lost
Harm the
patients.
possibility.
Yeah, the possibility or our ability to have a hospital in the future would be threatening to its ability to stay here or stay open. It was a little bit more explicit at the meeting. They feel they need to make this move to keep our hospital viable.
Viable, right. And they did say that admissions have been up over the last few months. And I think it's their intention to convert all of their rooms here in Latrobe and in Westmoreland into private rooms. And they said
They've already completed that conversion to the 180.
The ones here, yeah, and I think they're doing that at Westmoreland too. So, but they, you know, when they said that they lost 3,000 patients a year to Indiana, Conemaugh, and UTMC, you know, we didn't get a breakdown of the number as to how many went to Indiana and how many went to Conemaugh. My argument was I think that the patients they're losing to Indiana and Conemaugh are people that are on the hinterlands.
Right.
They denied that was the case. Right?
I can't understand why we're a doctor's looking is going to aid or not aid sending a patient to the Latrobe. In other words, if that doctor is here in town and he's affiliated with the hospital, he sends the patient. If he's located in Unity and he's affiliated with the hospital, he sends the patient. Why do we have to move them out there to be able to send the patients into the Latrobe? That's what perplexes me.
As Alex said, that's the business model. That seems to be the way things are going in the healthcare industry. But I think
I guess the challenge is a couple of things you have to keep in mind. One is there is a track, and that track is an approval track governed by the Unity Township's ordinances, be they zoning or subdivision, land development, highway issues, and so forth. They're still on those agendas. There was also a lot of decisions, including, I guess, a purchase of land that the hospital has made or executed with the developer's agreement with the, and I'm not sure if it's Arnold Palmer or who's the exact seller. And then there's the business deal that they've made with, sorry about that.
the Minnesota.
Franshu. Frauenshuh.
Sounds like a good beer.
And to get to that point, there was a lot of probably discussions with our local doctors, including Dr. Waggle and others who could probably been in the interim investors in whatever building. And they're looking to have them be investors in this building. But the model is this private company will build on their dime this building in the guarantee of a 20-year lease from the hospital to do this. So the challenge is, and not to overstate what may have been stated related to putting it on hold, much has already been out of the gate. They did allow or would allow us to at least look at the data that they have from their feasibility study and potentially offer some sort of alternative. But that puts us at a great disadvantage. While they spent maybe months and a year to get to this point, we're looking at maybe the possibility of only having a few weeks to reasonably reply to it. So I don't want to overstate where we're at and make it sound like, you know.
So Dr. Weigel might move out of town?
No.
Offices out of the Troutman building?
No.
He said he might be an investor.
He, like all of the docs, are being offered opportunities to invest in this. And I feel like the building with the 29 or so acres that they have is not only what's being offered today, but has expansion concepts for the future. And so it may not be initially that more than a couple practices are affected, but eventually they would be affected. And so that's a concern that this is just the first step in that eventual, pressure.
Any future growth would certainly be directed out there if they were to go through. And I said, I'm a betting man, and I wouldn't bet against their plans as they are.
If Dr. Weigel is going to be an investor, he surely.
No, I'm saying they're being
He's not
offered
an
to.
investor in that.
His
No.
investment is tied up in that Trump
Right.
building right now.
That's his.
They're the ones who
That's his
spent
baby.
millions of dollars to transform it from a,
Yeah, I understand.
Department
So
store.
he's not going to be part of this new construction then?
he has an interest in staying where he's at, and the
Right.
other doctors stay nearby because he's put a lot of money as we have into a garage and they have in the buildings.
What it seems to me is we're being put in the crosshairs of either trying to save our hospital or save our downtown. Because if we want to save our downtown, we've got to replace the professionals that end up going out to Unity.
Right.
Perhaps with competition, but that's not good for the hospital, because then
Right.
they might not, so we're eventually going to be faced with that. At least that's how it's looking to me.
Unless the hospital, unless Excela Health
Unless
itself
they
can
change
come
their
up with a
position.
compromise and maybe.
There
They're
is.
buying up these doctor practices like crazy. They bought up Dr. Lara, who is a surgery. He's had his own building out there. He was a part owner of the one up there on the Donahoe Road by the cemetery out there, where all the surgeries were done. I mean, that's why the hospital is probably trying to buy all these practices, because they know they're losing it to those outlying places.
Right.
The place up around 30 that they're right across from the
Med
new
Express.
drugstore.
Med
On a
Express.
Saturday and Sunday, the place is full.
Right, it's a 3 to 4 hour wait.
It's full.
Yeah.
The people
so
are waiting.
Yeah, what's the express about
Yeah,
that?
yeah.
It's like getting behind someone in the express lane.
Yeah.
They were gonna be-
But they're losing revenue.
They have more
That's
than
what I'm
12
saying. They're
items,
losing
and I
revenue.
always count too.
And that's what they care about, making money.
Well, anyway, if they do put the building up, Alex, we should ask them to tear that other one down. Across the street from the
Why,
hospital.
that could be repurposed.
I don't think it should be. If they want to repurpose it,
They'd be more than happy to donate to the city of Latrobe probably for $1.
thank you.
That they would, because it's a loser for them.
So that's pretty much the gist of our meeting there, Richard.
Thank you very much. I think there, by the way, Mr. Deputy Mayor, I think there is a commission that exists in Pennsylvania where you can discuss these matters as to whether or not there's efficacy in the construction of another hospital. And I don't know how much power that currently has, if it has any, but you might want to look at that and see. I know definitely, in fact, the older Mr. Vince Petrini was on that commission, and I think they had to decide whether or not a hospital should be built next to another hospital and things like that. So you might want to check that. Thanks. Thank you very much.
Mr. Kelly, the crosswalks.
You know, I told you that there would be a letter sent to the insurers that's been dictated.
Oh, okay.
I'll send you a copy. Or should send to our carrier asking if coverage is available.
Crosswalk?
What else we got, Alex? Anything else? Public Works? Alley pothole repair? I think that's one of my charts today. Joe, you're ignoring me.
We are meeting tomorrow with PennDOT to review. PennDOT added about 4 miles to the liquid fuels map of our city, and we'll be meeting with them tomorrow. It will result in additional, at least those 4 miles, additional $9,000 in liquid fuels. But we have several, Ann and I went over some today, and I know Joe might have a few as well, that we still feel like they can be fit into the map as well.
I think any of this money, the extra money that we're getting on liquid fuels because of the submission of our alleys to those fuel programs, I think we should take that and dedicate that to alleys and start it. We can't continue to ignore our alleys. I mean, we haven't had money for years. Now we've got at least a little chunk of change. Is everybody in agreement with that? I mean, let's
Smile and Sam's back.
Huh?
Smile and Sam, deep by squall, baby.
Well, you know, in spirit,
One time
in
you
spirit.
got, and I believe in that, but one time you said you got to do, you know, our streets, that's when I said business. Now you
Right,
want
well,
to
I'm
money,
just
no.
talking, no, you know, it's all one and the same, so to speak. And all I'm taking is just a small
The
portion.
9% represents about 5% of the liquid
Yeah,
fuels.
5%.
Well, no, I can go along with Kenny because, you know, we can look some, the $9,000 come from the alleys. You have to
Right.
Look at right
There
there.
you go.
And now you're
Good
looking at
point.
people, you know, like we want to plow snow and stuff like that. You get some of these people in these alleyways where they can park, stuff like that, where we can back plow to the curbs and stuff like that. You know, 'cause people, like, they weren't too happy.
People
because,
like
oh,
their
wow,
houses.
they're calling me up and stuff. You know,
I've heard a lot of complaints about the plowing downtown, especially the last time. I guess the trucks plowed it up so that you couldn't actually park your car by a meter, and you couldn't get out of your car because it was iced. It was just a very bad condition, and I think they only went through once. You know, and all the crosswalks, you couldn't walk across between Commercial Bank and Mellon Bank, or even down between the post office and the city. There was no place to walk. I saw people with what do they call
Walkers.
them? Walkers and things like that just couldn't move. You know, if we're going to plow, I think we ought to at least try to make it so that you can pull up to a meter and get out of your car without parking in the middle of the road.
I don't really blame our guys for that because, you know, basically most of the time, we don't have this freeze with this. And that's what really hurt. By the time, you know, these cars start moving, this stuff froze up because they're down in the neighborhoods now, and they're over here, they didn't quite get into town and do stuff. You know, I mean, it's like, you get the freeze, what do you do at that point?
Yeah, this is a universal complaint. I don't care what town, village, city, municipality you live in, people complain about snow plowing. I mean, that's just a fact of life.
Joe, you think
My
maybe
opinion.
it's time to maybe look at doing a route differently or something like that? You know, like sit down and Jimmy's or no, or?
That still won't solve the issue that Mr. Jim's talking about. You plow to the right. You can't plow to the center of the road. You plow to the right, and we take it over by the curb. Really, the only answer there would be to, once you plow, to pick it up and remove the snow, haul it out, and which would be quite expensive, as we've seen.
That's not feasible.
I thought maybe if you plowed a little bit closer to the curb, you know what I'm saying, so that actually you'd push the snow a little bit up on top of it'd make it easier to get in and out of the car. That's a problem that I've seen occur. And the other thing I wanted to ask about is salt in the garage. Are we using regular salt in this new garage? Are we salting around it or on the streets, Chestnut and Spring Street? Or are we using sand and some mixture or something? Any answers?
We are not using regular salt. We're using a product that's less corrosive and less harmful, that's more friendly to concrete. In the parking garage, in bad weather, we've been locking off the top, which is why I think you might be getting some complaints too, because we close the top off because we don't want to have to go up there and plow. We were told that would not be good for that surface. We do go around throughout in the garage where I see this ice, contractors see their ice, we do put down a de-icing material, but no, it's not regular salt.
How about on the streets?
Out,
I'm talking about Spring and Chestnut between Ligonier and...
the apron going into the garage,
No, the street itself.
the street itself gets regular salt by our trucks.
Maybe you want to consider using that less effective salt for that particular area, because I think the cars are dragging the salt into the garage.
Mhm.
Thank you.
Anything else?
But that's part of the reason why spring and fall maintenance will
Yes.
include at the garage, you know, the high power washings and so forth. We can't prevent a car dripping, you know, salt into the garage. So we will take care of it as a part of regular maintenance.
I'm just suggesting
Yeah.
you use maybe a different formula on those two particular streets.
Yeah, the challenge is just almost insurmountable because you load a truck, that truck's got a route. We have 3 routes, 3 trucks. that we run. I guess back in the day we had less. But anyways, so that truck goes out and he's got all his routes. I don't know how you also have to have a fourth truck that just does those. Maybe we can put some in your truck, Joe. Get a little spreader on the back of it. And you can hit those.
I'd say you put it in the back of your car with a little.
That's right.
with a fertilizer spreader or something.
Yeah.
See, if you still have the Crown Vic there, it'd be perfect, huh?
Anyway.
I don't know if you guys wanted to share any updates with the sanitation, solid waste committee.
Well, the only thing I can say, Mr. Deputy Mayor, we did meet with a representative of the hauler concerning the potential savings at the transfer station, which will involve the use of the hauler's trucks to remove the trash from the transfer station to a landfill. And it would be part of the package, and our employees would not be driving the trash to the landfill. And apparently this is met with Mr. Bush's approval, or at least the suggestion that was made. So,
Well, I think we're open to hearing what this company has. We don't have anything in writing. That's what we're looking at.
No, we do not.
Proposals and stuff.
Yeah.
What we want.
We're very much in like an exploratory stage where they ask information of us and we give them information, and then they come back to us with A, B, C, D, or whatever.
Like, basically some of the stuff we were running off before, they don't need to join us up there. They're able to lower them and come out the road gate. So we won't be crossing paths with them.
I mean, you're talking, and one proposal is to have a private contractor drive our roll-off boxes to the.
That's what we're going to try to do, all the trucks.
Trying to look at, we will
Right
still
now-
be in charge of scale fees and everything, and operating scale and stuff for our workers will. It would eliminate us from trucking business up to the landfills and stuff.
And again, that's one of the options. Another option may be to take over the house delivery of boxes, the home delivery of boxes.
Residential roll-offs.
And they're going to downsize, and Joe asked about they come down from 30 yards to 15
Yeah,
yards.
we would expect that hauler to do it with more choices for the homeowners. But again, right now, we're exchanging information, which we give them all of our tonnage data and that kind of thing, our permit information, and then we'll get back from them what they think they can do at what level.
They were just kicking around, it's not guaranteed. Just like they were looking at, like I said, we were getting charged $28 a ton of oil in the field. They might be for their rent space down below, they might be there for nothing. So now we'd have no, cost of that truck and stuff like that. Employees will be all working on our side. Because now the $91 we get, we'll be getting all that.
And the reason that comment is critical, if it's feasible, is back to the snow, back to a number of other things. It is a manpower issue, whether it's alley maintenance or whatever it is we do. You have to have the ability to have manpower to do it. And if you want to have a couple guys with smaller pieces of equipment doing some nip and tucking downtown to clear out different snow events, if a guy's pulling boxes, you just can't do that. But the question is, can you achieve savings by having someone else pull the box and be able to afford keeping the manpower? So that the manpower now is available to do.
We're going to have to, Ally. I don't think it's a question. I think you need the manpower out on the street.
And then the next issue will be equipment, and that might be through the 10th Congressional Rec, and we lease equipment, or we buy equipment, but there might be needs as well that we don't have.
That's because we're not doing anything.
We're doing a lot. We can do more.
But I mean, we're not doing the kind of things that we.
You've only had two guys dedicated to be out on road maintenance for the last 2 years. Am I not correct, Joe? 2 guys? Other than part-timers?
Jeff and Gary Jr.
Right.
That's it.
That's all you had, other than 2 part-timers.
Let's say we get this, we get
Joe
our
can't get stuff
manpower on
done
this
just
road
that,
department.
without that manpower.
We're looking at, instead of us doing our own grass cutting and everything, maybe, instead of getting pipers coming in and everything else. That'll save us money on that end too. I mean, us possibly cutting recreation's grass at a cost, that kind of service.
Is there anything new on the, in finding the people that destroyed the children's playground down there? and also that north side store that was selling those salts or whatever it was.
Those are bath salts, Jimmy.
What's that?
That's a done deal with the bath salts. That the rest was made and
Okay.
that's taken care of.
Was the owner involved at all?
I'm not free to discuss that. That's a state police case. As far as Playland goes, we know exactly who did it. Unfortunately, they,
Witness.
well, they won't talk to us. They, so to say, lawyer up. No offense, Jim. They won't give us a statement.
Yeah.
Is that it?
That's it.
Board code?